Dear committee, dear audience, welcome everybody to my presentation at the 3-month progress report. My name is István Szondy. I'm a medical doctor and a full-time PhD student at the dermatology clinic. First, let me share my vision with you, which is fewer complications in autoinflammatory and venereal diseases. To realize this vision, my mission is to introduce prevention and early intervention in the clinical practice to reduce the rate of complications. Right now, I have 3 ongoing projects, 2 of which are in the field of venerology and 1 in the field of dermatology. In my first project, which is investigating the efficacy and safety of doxycycline in preventing sexually transmitted diseases, I am conducting a meta-analysis with the help of my team. Sexually transmitted infections are a global problem. There are more than 1 million new cases of chlamydia, gonorrhea, and syphilis diagnosed every day worldwide. These infections are curable, but they have to be caught early, which can be challenging due to reluctance to seek help and asymptomatic infections. Untreated patients infect others, while the initially curable disease causes irreversible damages to the body. To prevent this, a novel approach is to administer doxycycline as a prophylaxis. Chlamydia and Treponema pallidum are sensitive to tetracyclines, while Neisseria gonorrhea shows moderate to low susceptibility. In a low dose, it is considered to be safe, so the question remains whether it is effective enough to prevent sexually transmitted infections, which is our goal to assess. For this, we use the PICO framework. The population is sexually active adults, and we have 2 interventions. It's either doxycycline pre-exposure or doxycycline post-exposure prophylaxis, and we compare it to no prophylaxis. Our primary outcome is the effectiveness, while we have 3 additional secondary outcomes. We hypothesize that the use of doxypep and doxyprep can result in a lower number of new STI infections, and with this we can reduce the incidence of STIs in high-risk populations. My systematic search resulted in 552 results, of which I have identified 10 eligible full text containing 3 RCTs and 3 abstracts of still ongoing RCTs with preliminary data. On the forest plot, you can see the total number of visits and the number of visits with an STI event. We had 4 studies evaluating post-exposure and 2 studies evaluating pre-exposure prophylaxis. You can see that 5 out of 6 studies showed a significant decrease in the occurrence of any STIs in the doxy arm compared to the control arm. The overall risk ratio was 0.46 with a significant confidence interval. On the next slide, you can see the result of the post-exposure studies only. You can see that the reductions seen here was also significant with a 0.5 risk ratio. And here you can see the results broken down by infections. For chlamydia and syphilis, the reduction seen in relative risk in the PEP arms were significant compared to the control arms. For gonorrhea, we also observed a reduction in the relative risk. However, it wasn't significant, and this aligns with our expectations due to the higher resistance rate among gonorrhea strains. Overall, these findings support our hypothesis that doxypep is effective in reducing the number of new STI cases, and there were no major concerns regarding adverse events, antimicrobial resistance, or adherence in the included studies. Here you can see my progress. We hope to submit the manuscript in the first week of January. And now let me present you my second project, which investigates the potential role of meningococcal vaccine in the prevention of gonorrheal infection. The growing number of multi-resistant gonorrhea strains is an emerging problem, and despite the attempts, there's still no available vaccination. On the other hand, we have several effective and safe vaccines to prevent Neisseria meningitidis disease, meningococcal infection. Neisseria meningitidis, a bacteria from the same genus, has very similar outer membrane components, which could be the basis of cross-protection provided by these meningococcal vaccines containing OMV components. Based on these, our goal is to determine the effectiveness of OMV-based meningococcal vaccines in the prevention of gonorrhea. The population of interest will be people eligible for meningococcal vaccines, and the intervention is OMV-based meningococcal vaccines. We compare it to no OMV vaccine, which could be no vaccine at all, or other meningococcal vaccines that don't contain this OMV component. The outcome is the incidence of gonococcal infections, and we hypothesize that meningococcal vaccines provide cross-protection against Neisseria gonorrhoeae, and with this we could lower the number of gonorrhea cases. Here you can see the results of my search key in the 3 main databases, and I have highlighted 4 key articles. All of these articles are comparing OMV vaccines to either no OMV vaccines or no vaccines at all, and raw data for odds ratio calculations can be extracted from all of these studies for comparison. This project is in early phase, but so far it seems feasible, and actually we are aiming to complete it by the end of February due to the high interest rate around this topic. And lastly, in my last project, which I won't have time to discuss in details now, I am investigating the therapeutic options in hidradenitis suppurativa adapted to each stages of the disease. To summarize, I have 3 ongoing projects right now, 2 of which are very novel topics of great interest. I plan to complete them as soon as possible. And then I will shift my focus to the last project, which will be a bigger project. I estimate that it will have around 150-200 articles included based on my preliminary searches. And lastly, I would like to thank you for your kind attention with a quote from Steinbeck. It is in the nature of man to rise to greatness, if greatness is expected of him. Thank you for your attention.
Very good presentation, and congratulations for your outstanding progress until now.
Thank you.
I had a question for the first project. So have you considered the safety of using an antibiotic like doxycycline as a prophylaxis, especially for sexually active people, and also how it could affect the bacterial resistance that we know it's a huge thing, especially for the future?
Thank you for your question. So for the first question, all of these studies evaluated the safety, so adverse events, and there were no major concerns regarding adverse events. The most common adverse events are gastrointestinal adverse events, and also there's a new study published in 2023 regarding the long-term use of doxycycline, because there are other diseases where it can be used as a prophylaxis for example, Lyme disease. And this study found that the long-term use, which means 8+ weeks, there weren't any serious side effects, only minor side effects during the long-term use. And your other question, the resistancy, is one of the main concerns regarding this topic. Actually, none of these studies found newly developed resistance among the bacteria, but these studies were followed the patient for around 1 year, and maybe bacteria need a longer time to develop resistance. So it is a concern, and I think the further studies should evaluate this for a longer time. But these studies couldn't identify any newly developed resistance. Thank you again for your question.
I would like to ask regarding your second topic. This OMV-based vaccine, is it like standard for the vaccine for the meningococcal vaccine, or is it some kind of special ones?
No, it's the standard. It's actually available in Hungary too. So it's standard. There are more standard vaccines, and some of them contain this OMV, but these aren't special vaccines.
So it's usual. So when I get my vaccine, it's a high chance that I actually receive, including the OMV.
Yes.
Okay.
If you receive in Hungary the ACBY vaccine, then you will get an OMV containing vaccine, for example.
I got it. Thank you.
Is there any data what percentage of the inhabitants in Hungary are vaccinated, for example, for meningococci?
No, I couldn't find any data on that.
Maybe from other countries?
In the USA, around 80% of the population. It's not the whole population. In a recent study, they were evaluating the the percentage of vaccinated people between 15 and 25 years old that they found it was around 8%.
8 or 80?
8.
8%.
Okay. What do you think using doxyprep or doxypep increase or decrease the antibiotic consumption?
Thank you for your question. I think it would, well, using doxyprep would definitely increase because doxyprep means doxycycline administered every day. And for a bigger population, it is a lot of antibiotics, but I think we would prefer post-exposure prophylaxis over pre-exposure, and also our study didn't have enough power to assess the pre-exposure, only the post-exposure. But regarding the post-exposure, I think it would increase the antibiotic. It would increase, yes, I think so. Thank
Thanks.
Yeah, my last question would be that were there any other potential pathogens, such as mycoplasma, investigated?
Thank you for your questions. Yes, 2 of these 6 studies investigated mycoplasma as well. Both of these studies were conducted by Molina, and one study found that this doxypep had absolutely no effect on mycoplasma genitalium. On the other hand, the other study, which is a still ongoing study, found that doxypep significantly decreased the occurrence of mycoplasma genitalium, but we have data only from these 2 studies, so it's still very controversial.